Okay, let's start. Welcome everyone in this new webinar session of F.E.M Women, which is our community of practice. We are working towards ending women's homelessness. Please do sign up to our mailing lists and get in touch with us so that we can also find out what you are working on, and we can share your work with our network. Our topic today is psychotherapy interventions for women experiencing homelessness. An example from Vienna. Our two speakers are Veronika Götz and Heike Lindstedt, who are going to talk about their work, the work of their organization called F.E.M. So they're going to be presenting this morning, and then we're going to open the floor for questions and answers. I invite you to also introduce yourself in the chat and share your questions in the question and answer box throughout the presentation. So if a question comes to your mind, don't hesitate to already send it to us. And in the chat box, please do share if you have similar practice or what your experiences are. We know the context. We know that women have experienced or are experiencing complex trauma and are experiencing the impact of such trauma. We know that the mainstream mental health services are too high threshold and are often inaccessible for women, especially psychotherapy, talking therapy. So I'm very excited to hear about the work of F.E.M, how they are engaging with women and design service to ensure that it reaches women. I give the floor now to Veronika and Heike. Thank you for being here, and the floor is yours.
Thank you. I will start, and thank you, Heike. So I'm Veronika Götz. I am a psychologist, and I work for our program Gesundheit für wohnungslose Frauen und Familien, means health promotion for homeless women and families. And Heike will speak after me. So you can shift to the next one. Thank you. Our program is from Frauengesundheitszentrum F.E.M, means Health Center for Women, and that belongs to the Institute for Women's and Men's Health, the Institute for Women's and Men's Health. And you can see we have different departments, and we reach different target groups, and we work with different professions and also different languages and so on. And if you shift to the next, you can see our team. At the moment, there are 130 employees of the Institute. But you can shift to the next. Yes, we, Heike and I, we work with homeless women, and in our project, this is the target group. So I will talk a bit about the homeless situation of women. I think we all know that the poverty risk for women is higher than the poverty risk for men, and that belongs to the structural situation of the society, because women do less paid work and do more unpaid work. That the housing situation is different from the housing situation for men, because often women are dependent on their partners financially. So also their home, the they also depend on the home of their partners. So if they break up their relationship, they can lose their homes too. And so they often stay in abusive relationships to keep their homes. Women also try to use their social nets before they come to services. So often you don't see women on the streets, living on the streets, you see that women are often hidden homeless. So it's very difficult to reach them. And physical and psychological impairments and addiction are also related to homelessness. So you can shift to the next. So, as I already said, women homelessness is all often hidden. So you see it via that there are living a lot of more men in shelters than women do. So if you as an institution are women specific, it is very important to be visible as that. So women can come to you when they see that they are for women. You can shift to the next. Thank you. Yeah. What are the requirements for a support system that is suitable for women? It is important to empower and support women. It is important to believe what women say, to have trust in what they say. It is also important to stand on the side of the women so they can feel support and safety. You also have to have female professional staff, so it is possible to work from woman to woman, and also to provide a safe space for women to talk about the experience of violence. It also is important to have an awareness of the social and of the situation of the society, how are women treated in our society. It is also important to have cooperation and networks, so it is possible to have interdisciplinary collaboration, and you can connect and accompany women to other institutions. Yeah, you can shift to the next. Thank you. What can mixed gender institutions do for women? First, to consider women-specific issues in the concept. So as I already said, it is important for women that it's visible that they are addressed. So institutions have to be recognizable for women. It is important to have safe spaces, literally like single rooms, separate entrances, women areas in the institution, but also figuratively, so they can feel safety and they can talk about the experiences. It is important to have, as I said, women staff, so it is possible to work from woman to woman. For the teams, they should consider women-specific issues regularly. It can be helpful to have a women's representative in the team, and it can be helpful to have further trainings for the teams. And of course, very important is that violence is sanctionized. You can shift. Thank you. So in summary, we can say that there is a correlation between health problems, poverty, and homelessness. There are limits of access to the healthcare system because of no insurance, no financial resources, bad experiences, but also because of that the healthcare system is very complex too. And as I already said, it is problematic that homelessness among women is often hidden. So women can reach us in our office only through homelessness institutions. Thank you. So I start to introduce our program and our work in Vienna. So our program is called Gesundheit für wohnungslose Frauen und Familien, as I said, health promotion for homeless women and families in Vienna. And we belong to the Institute of Women's and Men's Health, and we cooperate with the Vienna Homeless Assistant Network. And we are funded by Fonds Soziales Wien and Wiener Gesundheitsförderung. Our project started in 2005, and we collaborated with one institution. And now we collaborate with more than 40 institutions, and we have 9 employees and additional trainers, and there are more to come. And it's really cool. We are addressing women, teen persons, and families. And in 2010, we also started with a network events that is called Wiener Plattform für Gesundheit und Wohnungslosigkeit. In English, it's Vienna Platform for Health Promotion and Homelessness. Here you can see our team. Our basic attitudes are that we are needs-oriented and we have low-threshold health offers. We are participatory, and it is important that women designate our content. Empowerment is very important in our work, and if women want, they can stay anonymous in our counselings and our offers. We have a biopsychosocial insight of health, and so we have an interdisciplinary approach. And we see ourselves as a connection to the medical and healthcare system. Our project goals are that we want to support women and families in their mental, psychical, and social health. We want to support employees of the Vienna Homeless Assistant Network in aspects of health promotion and care for homeless women. And we also want to support the interdisciplinary and intersectional networks. We work with institutions in terms of networking, and we also offer professional trainings to the teams. So we have different offers for the institutions. Our networking is looking cross-disciplinary and cross-institutional. We have a regular collaboration in and between institutions. That is because we go inside the institutions and we work with the teams there, and we as a team also come together and connect those institutions. We also get to know offers in Vienna's homeless assistance system. So it is important for us to go there to visit the institutions and to get to know those institutions personally. We also offer, as I said, further trainings for teams, and topics can be gender, violence prevention, and topics that the teams are asking for. And we are also a part of structured networking in the Vienna Homeless Assistance System. And as I already said, our own network platform is the Vienna Platform for Health Promotion and Homelessness. And here you can see our website and a photo of one of our events. The website is in German and the events are also in German. It is an open forum for professionals and persons who are affected by homelessness. There should be a network opportunity not only between the homeless assistance system, but also the health system. So as we see ourselves as a connection between those institutions, we have those platforms. And there can be lectures, panel discussions, roundtables, and so on. It is also participatory, so the participants can ask about topics and so on. And at the moment, there were, from 2010 on until now, we had 31 meetings with around 100 participants each, and it takes place twice a year. Our next event will be tomorrow. So if you're interested, you can join us and you can sign up on our website. The event will be online, but it will also be in German. And the topic will be violence experienced by men. Tomorrow we start around 1 p.m. So if you want to get in touch with us, feel free, sign up and join our event. So I will hand over to my colleague Heike. Thank you.
Thank you. Hello, I'm Heike. I'm part of the project since 2009. I started in the project as a shiatsu practitioner, and I have finished the training as a psychotherapist, and at the moment I work both shiatsu and psychotherapy in the project. Yeah, the abbreviation of our project is GWFF. And the context we work in, the houses, the institutions we work in are the different shelters of the Vienna Homeless Service. They're called Chancenhäuser, stationär betreute Einrichtung, Housing First. That's just different offers to homeless people in Vienna, different focuses. Some institutions focus on young adults, others on women, others on teen persons, families, single parents. So we, when we go into the institutions, we find the focus of the institution and work with the women who are at the different shelters. The different supporting organizations, there's just what they're called, Obdach Wien, Neunerhaus, Caritas Wien, Wiener Rotes Kreuz, Hilfswerk, Volkshilfe Wien, Arbeiter-Samariter-Bund. They're different fundings, different organizations in Vienna. When we go into the institutions, what we offer our clients, there's the main or the most hours we offer are counseling, psychological counseling. We also offer shiatsu and health counseling on a one-to-one basis at the institutions of the Vienna homelessness institutions. Meaning we are going inside, we find the women where they are at the institutions. When we offer psychotherapy and shiatsu, the clients also come to, they have to go to our place. So we don't go to them, they have to come to our place. When we do the group activities, we like physical activities, psychotherapy and other health promotion for women and children. We also offer that inside the institutions. Our team, you saw a picture of our team before. Our team at the left side are just the names of our team, and on the right side is what the things we offer. And this is just an overview to show you we have a big variety of things to offer to the women. Also to provide something for, like, maybe not every woman, but most women can find maybe something that they can, that resonates with them, that they can use. We have the counseling. We have counseling for, especially for elderly validation by Naomi Feil. We have psychotherapy. We have shiatsu. We have the groups psychotherapy. We have groups with yoga, with easy exercises. We have line dance. We have women's groups where women can come and talk, bring up the topics they're interested in, what they're concerned with. We have creativity groups working with wool, for example. We have singing groups. We have children's groups where the children can move, play, and also if they have the need, they can talk. And we have a gynecologist who does information groups. So women can ask their questions in an easier situation than maybe going to a gynecologist is like too high threshold, and that's the easy way to, they can ask questions before they go there. The counseling, we do the counseling in the 40+ institutions. We offer around 120 sessions per week, that's more or less. And the clients come to us for those counsel sessions because they are either residents of the institutions or visitors of like day centers. So they find us through, because they see us at the institutions when we're there, or because the colleagues who work at the institutions, they maybe invite the clients to come to our offers. The groups, as I said before, we have a wide variety, and they differ from the frequency that we offered. Like twice a month, we have the easy exercises. Once per month, chair yoga, that's also for elderly. 3 times a week, there's a yoga group at different institutions. Twice a week, the line dance. Once a week, the children's group. 6 times per month, singing. 6 times per month, the creative group, and 6 times per month, the women's group, at different institutions. For the groups, it's the same as I said for the counseling. The clients find us either through members of the colleagues who work in the institutions, or through members of our team. Like when one colleague of our team works, like say the yoga group, and a woman might be interested in creative working, then our colleague will tell them about the offers we have for the creativity group and so on. So we have the, we invite the women to come to other offers at different places also. In those cases, when they're open, because we have some groups are open to all clients, like when it's in a day center open to all women, then every woman can come there. And some groups are inside a certain institution, and then it's only for the residents of that institution or of that center. For the psychotherapy, we have actually we have more than 2 psychotherapists in the team, but we have 2 people in the team working as psychotherapists on the project. We have about 15 sessions per week at the moment. The frequency with the women is either weekly or every other week. That's the plan, at least. Sometimes there's more because of absences. There might be less frequent, but that's what we aim for. To work on a consistent psychotherapeutic process. And as I said before, it's the same thing. The clients either find us through members of our team because they're in a counseling with a colleague, and maybe they move because the housing situation changes. If they have to leave this institution, or if they cannot have to leave, but if they leave the institutions, then they cannot, in some institutions, they cannot continue the counseling. So they are referenced to us as psychotherapists if there's interested, and if there's also the capacity, if the client, if the woman is able to keep the sessions, to come on a regular basis. So that depends. The group psychotherapy is a rather new concept that is in process of establishment. We had so far, there were 4 sessions where one woman appeared, so it wasn't really a group. Also because there was a long summer break, the women who are interested at the moment in the group psychotherapy have children that go to school. So in the long summer break, they don't have anybody to look after their children. So we had a long break there. The plan is to have the group twice a month and to have it with 3 to 4 clients. And again, they either find us through institutions who know that we offer this group psychotherapy, or through members of a team. And at the moment, there's a waiting list. So there's a waiting list both for psychotherapy and for the group psychotherapy, where I said the 2 psychotherapists with about 15 sessions a week, but the need would be greater. But we don't have, at the moment, we don't have the resources. Yeah, sometimes when they're on the waiting list for, I don't know, a couple of weeks, a couple of months, and we have space for them, we could offer them psychotherapy. Sometimes their situation has changed, and so it's not possible anymore. So there's this kind of fluidity in the waiting list in the process. The shiatsu treatments as another one-to-one offer we have. There are about 7 sessions per week. The women can go to the shiatsu every other week or once a month, depends. And the same thing there. There's shiatsu inside one institution and also outside, where the women come to a practice to get shiatsu there. What's the important thing about, or the thing that I think is important for the clients, is that we can offer a continuity of relationships because we work with so many institutions in Vienna, so that the clients meet several members of our team in different institutions. Like, say they live in one place, they go to a day center and find a group there, or find counseling there, and and also if they move housing, maybe they go from one institution to another, or maybe leave one institution, are back on the street for a while, this happens, and then come back to another institution. So we find that inside the team, we know clients. Several team members of us know certain clients, and they find help from our team again in different places where they go. And of course, they may attend different activities, offers from our institutions. They can go to different, there's a networking between us too. And yeah, and they also may continue to attend our program even after they change housing situation because of this situation that we have, or if the offers that we have where they are not in the institution, either in a day center, or where they come to psychotherapy or shiatsu, that's independent of the housing situation. They don't have to be at a certain institution to continue that. Frequent topics that appear either in the counseling or in the psychotherapy is, of course, the most obvious is the homelessness situation. Or then if they move from one institution, maybe to housing first, or to get their own apartment, the change to live on one's own is quite difficult often, because they're not used to it. There's loneliness. There's how do I do things? There's the daily life challenges are quite challenging for the women often. There's a frequent topic is the relationship with partners or ex-partners. Like Veronika said in the beginning, sometimes there's violence, sometimes there's conflicts. The self-worth is a topic that appears over and over that we work with the women. The question of parenting, often there are mental health issues connected to the homelessness situation, and severe physical illnesses or disease. For the topic of homelessness, in psychotherapy or in counseling, there's the question: what caused the person's homelessness? What's the background? What happened? Like I said before, moving from an institution to an own apartment, the change of being by oneself. There's no one to talk to. One client said to me, she really misses this. She likes the new flat she has, of course, but she really misses to not have the opportunity to just go down the stairs and talk to someone at any time of the day. And that was a real change for her and made it really difficult. And also managing the aspects with the home of one's own, like, I don't know, there's something wrong with the sink, I have to call a plumber. How do I do that? I have to call the people who are responsible for that. That's often difficult. Daily life challenges, managing the daily task. I have to go to this or that. I have to go to the doctor, to different appointments that they have, that are important for them to receive their money, maybe. And it's really difficult to manage these, or to prioritize them. Also to find motivation to do some clients tell me there's one task every day that's more than enough, one appointment every day, one place to go to. And even if there's one appointment every day, 5 days a week, that's too much. So there's really this kind of the question, if I have too many tasks, which one do I prioritize to manage my life, really? The topic of relationship with partners or ex-partners, often there's violence involved. How do I deal with conflicts, with disagreement? That's something we work on very frequently. Connected with that is to learn how to protect one's boundaries and to develop autonomy. I mean, these are topics that every one of us, I mean, maybe not everyone, but arguments, boundaries, autonomy, we all have these questions, but for these women, it's often more difficult. The topic of self-worth, often there's the situation of the family of origin that comes into place there. How were the conditions during childhood and adolescence? Did they grow up with their parents, with their family, or in a foster situation, or was there a lot of change? Often there's also a lot of change between parents, a foster situation, other people of the family taking care of the child. The experience of psychological or physical violence, experience with drugs, either by their parents or on their own. And also the question, how do I cope with my emotions? That's something that comes up very often, and that's a difficult thing. Like, often it's how do I cope with my anger, with my aggression that comes up? How do I cope with sorrow. The question of parenting, especially for women with children, of course, women who are single parents often have questions about parenting. And also clients who, I put it to parenting, interaction with pets, because there's similar topics sometimes coming up with in the clients when concerning pets that you would see with in the question of parenting of children. And mental health issues is, of course, one factor for homelessness. Also, that women with mental health issues have a greater risk of homelessness. For example, schizophrenic disorder. There are clients with medical treatment. In psychotherapy, there are clients with medical treatment. We find, of course, clients without medical treatment in our other offers, but psychotherapy, I don't have a client without medical treatment, and I would maybe find it difficult. I don't know. But also the question of, do I take medicine or not? What do I fear about taking medicine? Yeah, it's a topic. Also understanding one's history. How could this happen to me? Why me? How do I cope with it? And how do I manage my daily life with mental health disorder? And also with the trusting or the distrusting one's senses is it's a topic. Like one client told me about, she doesn't, she often fears being at home at night because she hears voices crying from the neighbors somewhere in the house. She doesn't know where, and she doesn't know if it really exists or not. And there's this question: can I trust my senses? And maybe there is somebody in another apartment who needs help, but I don't know, if they call my name and they actually don't know my name, then it's probably, I cannot trust my senses, and it's probably in my head, but maybe not. Who knows? Another topic is the drug-induced psychosis. If that happens, clients who experience that maybe go to a hospital, come back from the hospital. It's a question to understand what happened to me, why did this happen, or how did this happen, and the process to getting back to normal. At the moment, I work with two women. One woman, she had was diagnosed with depression before. Then she uses cannabis on a regular basis, and in a period of stress, because her daughter was taken away from her to foster care, she experienced a drug-induced psychosis, and she was in the hospital. She came back, and now to get back to her life as normal as possible, to see her daughter every weekend, and maybe now the daughter may sleep at her place again, to find out how it's like a way back into normal life. Yeah, and another case where it actually came quite out of the blue, a woman who doesn't use cannabis on a regular basis, but just like once, and in a period of very, very hard stress. She was worried about her family. She was worried about she had stress with a new training course she did. So there was really great stress, and she experienced something she never experienced before in her life, that she had a schizophrenic paranoid episode. And that was really frightening and scaring for her. And now to find out, discuss that, find out how does that fit into my history? How do I deal with that? Depression is a frequent topic, of course. Connected to depression is the use of drugs, sometimes illegal drugs, sometimes alcohol, as self-medication. Suicidal ideation is sometimes connected with depression and suicide attempts. And also severe physical illnesses or diseases, like when clients have diabetes type 1, that's a great stress for the body, for the daily life, for how do I manage maybe the risk of if the blood sugar is not very stable. That gives great instability to my life too. Anything can happen at any time. Epilepsy, what connected to severe illnesses and diseases are often financial problems, like when I can't work, when I can't have don't have a regular income, at sufficient regular income with my because of my illnesses. There's a problem of becoming homeless. And sometimes also to understand the healthcare system, like to find a way into that. We see ourselves also as like to building the bridges to the healthcare system. Where can they go to? Where can they find help if this happens to them unexpectedly? How do they find their way into receiving support they need? The most relevant effects of psychotherapy, that's not very special to our project, but in general, is being heard with one's worries, hardships, needs, and desires. And maybe it's a little bit more in this project than in free practice. Because the worries, the hardships, and the needs are maybe just harder than average. The experience that somebody really takes the time and listens and tries to understand might be an experience that these clients, these women, have for the first time in their lives, that there's somebody who's interested, who really wants to know, and that there's somebody who cares. And not only one person, like we're the team, we're the network, that there's actually people who care. That makes it like another step. And now the difference between clients and then like in regular psychotherapy and our project in psychotherapy sessions is there are more cancellations of sessions and more absences because of the backgrounds, the things I mentioned before, because of illnesses, because of depressions, because maybe it's just too much, too many, or because they forget. Also happens. Connected to, no, not connected to that, sometimes connected to that, sometimes because of other topics. There's more communication in between sessions sometimes, like I forgot when's my appointment, I have to like tell them again when is the appointment, write an SMS maybe. Also SMS reminders preceding the appointment, that really makes sense to reduce the absences. Something that I do is I contact clients also more than once in cases of absence, because there are just times when maybe there's an episode of where they just can't leave the house, or are just in like a more depressive time, then it needs more than one trial of contacting them so they can come back. And that's maybe something you would say in psychotherapy. You don't do that. You have an appointment, and if the client doesn't show up, then it's their decision. We see it that it's actually sometimes not the decision of the client, but just the circumstances, and we try to deal with that in like more than otherwise you would do that, making a step towards the woman. Suicidal ideation happens probably more often. I have clients in that situation. I tell them I will react within 24 hours in some way. Like I write an SMS when I would have time to make a phone call with them or so, and have a contract with the clients not to do anything before we have a direct contact again. Also phone calls. Sometimes there's a spontaneous phone session in between regular sessions when there's a crisis. And of course, the situation when I have time, it's not always possible, but this happens, and it doesn't really happen so much in the psychotherapy outside of the project. Critical situations occur more often, drug overdose maybe, other the drug-induced psychoses, things like that. They occur more often in this project. Things we hear from our clients, like, thank you for all the hours you've worked with me. I believe a lot became easier for me now. When I hear your voice, I'm getting calmer. I'm feeling much better since you call me every week. I'm very grateful that you're here for me. And for the exercises, focusing on the exercises helps me to clear my mind and let the sorrows go away. That are like exercises, physical, but also like breath exercises or calming exercises. Yeah, there's some sources for the reading, how you can contact us if you're interested to, and thank you for your attention.
Thank you so much, Veronika and Heike. I think it's an excellent example of how you adapted and designed the service to the experience and circumstances of women with the pre-engagement phase of going to where they are, and then how you are actually delivering psychotherapy with the women. We have quite a few questions in the question box. The first one is from Berenice from France, and she's asking, how do you offer psychotherapy to women? Do they have to meet certain requirements?
Yeah, well, yes, they have to be interested in a psychotherapeutic process, which is like higher level than just counseling would be. Like when they find counseling in the institutions, that's much easier for them and for the psychotherapy, because they have to come to us. They have to be able to manage that and keep appointments, not every time, but somehow on a regular basis.
Yeah, just to follow up on that, one of the issues that often comes up is those women who would like to maybe access therapy, but they have substance use issues, or they may even have a dual diagnosis. And often mental health services are not open to women who use substances, and they say they should come back when they dealt with the substance use. What is your approach to that?
yeah, no, they may use substances if they do, they may do that. I don't encourage them to come with substance use to the session, but they don't. That's not my experience.
Okay, great. Second question is actually many questions. Is the individual and group therapy limited in duration? How many number of sessions per woman, and how many sessions on average per woman in practice? So how long women are staying?
We don't have a certain amount where we say, I don't know, 10 sessions, 30 sessions, and then stop. It's really individually different. And we see that it's really important to be with the woman in their process. Really, you can say you have a process, and then crisis happens, and then you can say, well, now the numbers of sessions is over. So we don't do that actually. Yeah, we have an open number, and the questions to how many, usually it's so different. It depends. There are women who come, like, I don't know, there was one woman who came 12 times and said, thank you very much, you helped me with my problem, everything's fine. And I thought, well, maybe some things are fine, maybe not everything, but it's her decision, of course. And then maybe we see her, this woman we didn't see again in another place, so maybe it was, she fulfilled her goals, and that's fine. And some women who just, we, like I said before, also inside the team, comes back. Yeah, they can also, they may have a pause and say, I have had enough now, or maybe I have too many things going on at the moment in my life, I cannot come anymore, but I would like to come back in 6 months' time.
Is there a specific psychotherapy model approach that you follow, that you use?
Well, at the moment, the two of us are both person-centered training. So that's, and I have the feeling that's fits the situation with the homeless woman very well.
Yes, great. We have another question. I'm just reading it, sorry. Could you tell us more about the contract with the suicide ideation patients?
Yeah, I mean, it's depends also on the woman and on the situation, of course, but it's basically, it's really that, I mean, keeping it simple, but really that, please don't do anything before we talked again, we met again, whatever. Yeah, that's the basic thing. And also when we will see each other again sometime, but also make an appointment or make a time when we talk on the phone, to really have something they know, okay, I will talk again or see her again then and then, and that's like a time period I can cope with.
Oh, that's good. And
also, of course, I give them also the telephone numbers for where they can call anytime, 24/7, to, like, their phone numbers in Vienna that are for really acute situations.
Yes. The next question is alcohol. Is it a topic? And women, yes, who use, you mentioned it, but is alcohol use a problem among women?
Yes, sure. Not on all, of course, not with all women. Sometimes it's also alcohol plus other drugs. Yeah, maybe Veronika, sorry, maybe you want to say something to that?
No, yeah, it's fine with me. Yeah, I also see that alcohol is a problem. Yeah, maybe it was not focused in our presentation, but it's a very big topic too, I would say.
Yes. Mm. The next question is about how do you ensure the funding for these services? Do you receive local, national, public funding, private funding?
There are two fundings, and it's from city of Vienna.
Yes. Great.
Yes, it is. Yeah, we're very happy about that.
Yeah,
really
absolutely. There's another question about the. Sorry, could you please talk about the phase of pre-engagement? How do you proceed? How do you contact women? I think I use this pre-engagement term. I don't know if you use it in your work, but I think it's the part where you go to see women in their residence, in shelters or in day center, and offer counseling there.
Yeah.
Yes, we offer counseling, or we're just visible there. I think that's also something many women, or some women, just need time to like get used, get to know us, or get to have the feeling of trust to approach us. And then there's so many steps. Sometimes this process takes months and years, really. For the woman to say, okay, I've seen you, I don't know, for 6 months now in this institution. Now I will come up to you and ask a question. And yeah, there was a colleague, and she told us the other day that about the process a woman made in the beginning. She didn't want to talk at all, or maybe she opened the door like this much, and they had conversations, just seeing each other through the not nearly closed door, and then the door was open, and then she talked more, and again, and then she left the institution, and now in another place she found a psychotherapy place. So there's, you know, there's to see this process is really so yeah, fulfilling.
Excellent. We have another question. Is the funding for everyone? Can women without health insurance, for instance, EU migrants, get psychotherapy too?
Yes, they can, but it is through the homeless institutions. So when they come to the homeless institutions, they can come to our offers. So we are connected to the homeless assistance system in Vienna. So that is the entrance.
That's the entrance. So anyone just dropping in to you?
It's not possible, actually, because we are in those institutions, and if you contact F.E.M with their counseling offers, it's not possible to come to us. You have to come to the homeless institutions. Yes. Yeah.
Okay. It's clear. I'm checking for more questions. In the meantime, I would like to ask, you mentioned a variety of group activities available, and which are the most popular among women? I'm just curious.
I would say at the moment it is a singing group.
Oh, really? Yes.
Yeah. Yeah.
Yeah. I think that's also great to build self-confidence.
Yeah, and I love that there is such a big variety.
Yeah.
And it is a group which women in the institution want to have. So
Okay.
they ask us, and we could make it possible.
Great. Next question is about collaborating with universities to conduct research. Are you?
Yeah. We had this a few years ago, and sometimes students come to us and ask us about our work. So that is what happened the last years, I would say. We talk to students about our work, and they write lectures.
And how is your service evaluated?
It's the evaluation is like we collect the contacts with our clients. That is what we do, and that is yeah, our evaluation at the moment.
What? Great. I'm just checking if we have more questions in the box or in the chat, but I think we don't have any more questions, and I think we are coming to the end of the webinar. Thank you very much for everyone for being here this morning. Thank you so much for Veronika and Heike for their work and for telling us about it. And please do not hesitate to get in touch with F.E.M Women, and please share your experience of working with women so that we can also continue our work together. So thank you very much and have a good day. Bye-bye.
Thank you so much.
Bye-bye.
Bye-bye.
Bye-bye.